lumbar adjustment, these can often be quite challenging, particularly for a small practitioner like myself. I had a lot of trouble learning how to be effective in my lumbar side posture adjustments while in school. And now I've adapted some techniques that, with proper patient positioning and using my biomechanics to my own advantage, really helps me be successful almost every time with these adjustments, no matter how large your patient is. So let's demonstrate. I'm going to have the patient lay on his side facing towards me and bend the top leg so that the foot is in the crease of the knee. And now pull the arm through so that they lay on their scapula, and fold their arms so that their hands are overlapping on their elbow. Now from here, in order to help their lower back relax and apply a little bit more distraction into the spine, I'm going to gently lift and drag the patient down towards the table. This also helps get their shoulder out of the headrest so that their shoulder isn't jammed in the headrest when I thrust, which can cause discomfort for the patient, which then they reflexively tense up, and we want to avoid that. So I'm going to take my hand and cup just underneath the knee that's bent, and then the other hand reaches around and underneath the iliac crest, and I'm just going to gently lift and pull down towards the patient's feet to move him about an inch on the table. Now from this position, I'm going to contact the patient's wrist and use a digit contact on whichever segment needs to be adjusted. Now from here, I use my two hands to try to approximate them together as if to squish the segment in between my two contact points. And from here, we're going to position the patient so that I can bring my knee to meet theirs, and trying to keep my wrist as neutral as possible and keep my elbow as close to my body as possible so that I'm not here to throw out my shoulder. I'm here instead, creating a little bit of distraction in the sacrum as well. Now, a lot of patients will be a little bit tense in this position sometimes, just naturally, because you've twisted them up like a pretzel. It's an unnatural feeling for them. So a lot of practitioners ask the patient to take a deep breath in and breathe all the way out, which isn't always effective in getting them to actually decrease their abdominal pressure, their intra-abdominal pressure. So I find it effective to ask the patient to take a deep breath in and breathe all the way out, but then let your belly relax, or just let your belly go. Helps patients realize that they're still holding intra-abdominal pressure. So take a nice deep breath in, and as you breathe all the way out, just let your belly go. And then employ a kickstart, keeping your elbow close to your side.